In this video, I will show you how to use the chronic system. So when you log in, you will land on this specific page, and at the top you'll see every single day from today, 3 days back and 3 days forward, how many profiles needs to be actioned for that specific day. So if you have a look on the left here, you'll see that currently we are looking at all the new profiles. So those are profiles that have not selected yet in what program they want to belong to. So we have 3 programs. So we have a call program, which means if someone is in a call program, that person selected that they want to be called every time to ask which of the medicines they want to stop, start, or in fact order. The O2 program, what it means is someone selected that they do not want to be called, and neither do they want to receive an SMS to choose their medicine. They in fact just want you to prepare the medicine for them, and once you dispense it, they get an SMS to come and fetch it. And then we have a third option, which is the Order My Meds. When someone is in that program, it means that they will receive an SMS. They can then select and log in with their birth date and then choose which of the medicines they in fact want to order, stop, or skip. So when we look at any one of these new profiles here, I'm going to open up one specific one. At the very top here, there's a blue button that says program. So when you click on program, it will give you the ability to choose which one of these programs they want to belong to. So SMS, auto order, and there's also a decline. So it might happen that you do some calling to find out if people want to come onto the chronic program. They say no, they don't want to. Then you can also choose the client, and then you know that you in fact have contacted that person. But we basically will try and select one of these 3 options: call the patient, SMS the patient, or use auto order. So I'm going to do call here. The branch will always just be your branch in most cases, unless management add you to more branches. And if a person declined, you can also add in basically what reason they have for that. And then there's a delivery option that will also show on ProPharm. So it's just the basic ones that are on ProPharm. So it's collect, deliver, COD, post, and Dropbox. And then lastly, there's a priority flag. If you tick this, then on that specific profile, it will show a red flag that this is a priority profile. It might be that this customer have complained about service or something like that, and at least you'll then know that that profile needs a higher attention. So you will now see in here there are a little block here for profile. It will show the name of the surname of the specific person, and then it will show the branch, which at the moment is called train, but it will be the branch that you are in, with their profile number. This profile number as well is just randomized at the moment, but it will be their profile number as it is on ProPharm. Then on the next block, there's a task which will show either open or assigned or closed, depending on what task, the state of the task that you're busy working on. So whenever the system will go nightly, and it will create tasks for each one of these specific chronic profiles that you can then action to order and assign and close, etc. So, but I'll show you that now, so don't be too concerned about that. The OMM button up here will be removed, but it was just to show you how an Order My Meds will look when we do it, and I'll show you now as well. Then you'll have all your members down here. Again, their data has just been de-identified, as well as the ID numbers. But this is basically what it will look like with all their members down here. their contact details, any address details that has been on the ProPharm profile. You can then also click on notes down here, which is an office function just to make any sort of reminder for you and your colleagues about what happened on his profile. Got no answer. So whatever you want to put in here, you can, and it will always pop up when you open a profile, just so that anyone can see what notes has been made for that specifically. Okay, so then you'll see that the program is now on call. So I need to assign this to me. So I click on the Assign to Me button, which will show all the buttons here at the top. If you don't see the buttons here, then it means that the program is still on new. You just have to click on Program and change it to either Call, O2 or SMS. The first option we have after Complete is Unassign. So if you want to unassign this profile from you so that someone else can assign it, then just click on Unassign. It will then go back to the open state and you can just assign it again. You'll see that when you assign and unassign, it will show who the user is that is working on this, when it was opened, and then you can do that. Send OMM I'm going to show in a little bit because that's just a different path. But when you click on Send OMM, you are able to send SMS to the customer, to the patient, for them to then click on a link and order the medicine themselves. But let me show that to you a little bit later. You also have a call back function. What it means is you made a call to the person, they say, listen, I'm busy, can you phone me tomorrow at 10? And you just click on Complete. It will then put it in a task of call back, and under call back there will be 1. You'll also see that when you assign something to yourself, it will go into My Tasks here at the top so that you can keep track of what's assigned to you. And I'm going to then just click on Reopen here, which will then reopen and assign it to me. Okay, so that's basically it. Already you know program. Next, if you click on the next button, it will just go to the next profile. So the one on the list will just go to the next one, just to make it a little bit quicker for you to process things. So at the bottom here, we have the delivery options. That's the same as ProPharm. So it's collect, deliver, COD, post, and Dropbox. And the branch you can probably safely ignore because that will just be your branch unless you've been added to more than one branch. And then any special instructions you want to add to the script, it might be more medicine, different medicine, etc. And this is then all the available script items. So you will see that wherever it shows available, the date will correlate to today or 2 days prior, and anything that is scheduled is either in the future or, in some of your cases, the moment will be in the past. And then the first number here is how many repeats are left. So there's 5 repeats left on this specific script, but this is already 2 months over. So -2 means that 2 months ago the script ran out, and we will show this up to 3 months and then it will not be shown again. So for these specific medicines, the patient will have to get a new script. In the future, I will add a screen that I've removed currently. When you click on this, it will just show you detail of who worked on it, what was ordered, and also what the schedules are for the future. Last thing here I want to show you is there are bulk options here at the top. So you can click on skip to skip all the available ones, stop all the available ones, or just show that it's early for all the available ones. But we want to order all of these. So at the moment, I'm still creating a script on ProPharm, but it is in a state of test, so it will not show in your branch. But on live, where you're going to use it, when you click on Complete now, you'll see that it will create a script on ProPharm on their smart switch system, their e-scripts. I would like you to just please tell me if this is working as you expect it to work. I did test it with Nick from ProPharm from Compute Assist, and all the data did look right and correct when I did it on test, but I have not tested this with any live pharmacy yet. So please let me know if that is correct so that you can just dispense it. So when I click on complete, the task will go to closed and the next date will automatically be set. When a new script comes in from ProPharm, just remember that we will on the system make sure that the dates are correct for the next date based on how much medicine was dispensed minus a day or two, just to come in early enough on your schedule so that you can still dispense it before it runs out. Then under orders, there's you'll see an order has been created, and there's a dispense button here. So there's two things that will happen here. When you click on complete, a label, if it's set up on your printer from IT, a label will be printed with a code of your order, which you can then scan. So there's a label scanner option here. So normally what the idea of this is that you'll have a computer sitting somewhere with a barcode scanner, and when it will look like this, and you can just hold the package with the label that was printed in front of it, and it will mark it as dispensed. When the medicine gets dispensed, an SMS will go out to the customer, which I'll show you in a second, to tell them that they can come collect it. So I'm going to click on dispense here. So if you're not using the scanner option, you can just click on dispensed here, which will then show go to collect it. And then when a person did collect it from your collection desk, it will be good for you to also just mark it as collected. Then you know that it has been picked up and it's out of your stock. So there's a mark collected scanner as well, but you can just click on collected here, and then the order is collected and it's complete. So the task is open. I am going to change this again to call. Remember, you can change it to SMS or auto order, and then I'm going to assign it to me. Okay. So what I want to do now is I just want to use the send OMM button just to simulate, to show you what will happen in this scenario. So I'm going to enter in here my phone number. So this profile was an Afrikaans profile and not an English profile. The English profile will send an English message, and this will send an Afrikaans message. You can have this configured. This is per account, so for RNL, but it's configurable if you would like to change this wording. Just speak to IT about that. But it will basically look like this. So it will just say that it's time for your chronic medicine to be replaced, and then a link. The link will look shorter than this to the patient. It won't be this long because I'm just doing a test here. And it just says ignore if you have already received it. But when I click on this link, then it will show this is the experience the patient will have. They'll click on order. They'll have to enter in their date of birth. Okay, so the date of birth is 1933, 0418, so 1933, 0418. And then they will see the available medicine to them, and they can choose order, skip or stop, have any special instructions and shipping. But when they place the order, it will then come up in your OMM list here. So you'll see that we have 2 now because I did a test earlier, but you just need to keep your eye on the OMM block here. If there's any counter there, please make sure that you action that. And this is then, we'll then see which ones they chose as Order My Meds. So they won't be available anymore. They will show OMM because they selected it to be ordered. Otherwise, it will show skipped or stopped. And all you need to do is you just need to assign it to yourself, and then just complete the order again, which will create the order, the script on ProPharm, and then you just need to click on dispense or use your scanner to dispense it, and the same for collect it as well, and then it's complete. And yeah, that is everything. If there are any questions, please use the WhatsApp group to ask. Thank you.